At the end of the day, it's not the virus or disease that kill people. It's the discrimination and hate behavior and attitude towards it. It's how people are treating people who are living with HIV and AIDS, and how they are making them to feel small and to feel as if they are not good enough. Welcome to our 5th episode of Finding Beauty in Your Scars under Unspoken Truth Family. This is your beautiful host, HelenZanele. In this episode, we are going to talk more about HIV stigma, discrimination, statistics of it, and how a lot of young women have committed suicide because of this virus, and how those who are coming from a poor background have been judged, and how some of them are not lucky to find relationships because of the background and how they are living with HIV and AIDS. While I was doing my research, wanting to find out more about this virus and how it has affected a lot of people and how the statistics have been since the starting of it, I found out that it has believed or proven that by the global HIV and AIDS epidemic, that HIV has become one of the most world's serious health and development challenges since the first case were reported in 1981. Approximately 84 million people have become infected with HIV since the start of the epidemic. Today there are approximately 38 million people currently living with HIV, and tens of millions of people have died of AIDS-related causes since the beginning of the epidemic. That shows that HIV has been there for quite some time now. But it's sad how it's still, the rate of it's still continuing because of the lack of education when it comes to it. I wouldn't say the lack of education when it comes to it, but I will say how our government has neglected ukufundisa abantu about this virus. Abantu abaningi bayasaba to come out to ukukhuluma regarding this, I have interviewed one of the ladies who are living with HIV, and she said to me that if we can come together as a community or people who are living with HIV and start teaching young people regarding this virus, we'll find out that it's not that bad, and we'll find out that our community, they are ignorant because they chose to be ignorant, but they're ignorant because there is no deeper education when it comes to this thing. There is no, there are no longer topics in our schools recently when it comes to these things. So I would say that our government has neglected this virus, these teachings when it comes to this topic. It's said that a lot of young people are committing suicide, especially to those who are living with HIV, because you will meet someone, and then you meeting that person, you want to share your status with that person, and because loyo muntu loyo aganayo in knowledge when it comes to HIV, he will feel as if you will infect him, or her. Only to find out when you take your medication, when you stick to your medication, less than 6 months taking your medication, and when you go back to a clinic, remember after 6 months, you go back to the clinic to check how the medication is treating you and how it's reacting to your body. Is your body reacting well to your medication? Are you still being able to take medication and all that? In that period of you uthatha leyo medication, there are high chances of you having a viral load that is lower than undetectable. What that means? That means if you sleep with someone without using a condom, there is no way that you're going to infect your partner. There is no way that you're going to make your partner to be HIV positive as long as you're still taking your medication. So it's said how we are getting cyberbullied because of our status. I remember when I came out to someone that was close to me, because I needed someone that I can talk to regarding this virus. That person, he went as far as cyberbullying me, because of my status. That was I found out about my status in 2015. I think that was in the beginning of me taking my treatment and still being confused. Uguti, am I gonna die? Am I gonna live longer? Am I gonna survive? How are the people going to treat me? Am I gonna have kids? I don't have kids as yet, but it has been an emotional journey to go through. Imagine me coming out at that time, in a community, I wouldn't say that is well known, but I'm coming from Davidton. Davidton is known as a very fast cases, one of our cases that are fast and all that. But I believed that, I wouldn't say smart, but educated people like me wouldn't judge me when they find out about my status, only to find out Uguti, I was actually wrong about that. So many people are scared of coming out or speaking boldly when it comes to their statuses because of the treatment, discrimination, and stigma that they are getting from communities, families, friends, and relationships. I'm going to emphasize, especially when it comes into our communities. It's so sad how our communities are just treating abantu who are living with HIV. I wish there can be more educations when it comes to those things, such as how abababas how can I, for example, cancer, but there is no such when it comes to HIV. It's very limited to find education when it comes to HIV. When we do campaigns in one of the clinics, they will talk about drugs, domestic violence, bullying. I'm not saying lesers into lesers, they are wrong to talk about. No, we still need those kind of education when it comes to those things. But how about we give more people knowledge when it comes to HIV? Kissing someone doesn't mean you're gonna have HIV. Hugging someone doesn't mean that you're gonna have HIV. Sharing a face cloth with someone doesn't mean you're gonna have HIV. You get HIV if you sleep with someone who's HIV positive and they are not taking medication. Or let's say, for example, I slept with a guy only to find out that he was sleeping with me alone. The guy who infected me with HIV, he wasn't sleeping with me alone, but he was also sleeping with other person, and sleeping with him without using condom. Unfortunately, it has made me to end up being HIV positive. Those are the kind of things that we need to teach people. When you sleep with someone not using a condom and that person, they are busy sleeping around, there are high chances of you to be infected with this virus, Not when you're kissing someone and you're going to have HIV. It's not like that, It's sad how young people, when you come out regarding your status, they will start looking at you in a different form or in a different way. What? You are living with this virus? You bohamba ulala with every Tom and Dick and hair out there, only to find out it's not like that, The stigma around it, the discrimination around it. Imagine someone coming out with she's HIV positive, and that person I get called that strong as me, then lawyer right in them, they commit suicide because of the stigma and discrimination that they are getting from abantu who are judging them. So me today in this topic, I felt like I need to teach more people regarding this virus and how poor communities are getting ill treatment, how our economic is contributing into this virus, it has made a lot of people not to want to be into relationships because you don't want to be rejected. There's nothing as painful as being rejected. I've been rejected a lot into relationships because of my virus. I've been judged a lot because of my virus, I can say that currently I found someone that when I told him about my status, even though we don't talk much about it, but the support that I get from him, it's something else. That actually there are people who are knowledgeable when it comes to this kind of virus. So we still need people like him who teach our fellow brothers or sisters that, dude, come on now, it's not that bad as you think. As long as this person is taking their medication, then there is no way that you're going to get infected, So I feel like we still need to teach people, because living with this virus has made a lot of people to doubt themselves and to believe that they are not deserving of love, care, respect, and support. It's so sad of how when you're living with this virus, you feel ukuthi wena akumelanga uthole uthando, wena akumelanga uthole the support that other people are getting. Like uzoba nale ilifu elimnyama, this dark cloud that is surrounding you the moment when people they find out about your status. It's just so sad. There's a lot of progress when it comes to treatment of it, but no progress when it comes to the mindset on how we are treating people who are living with this virus. And that kind of treatment, it has led to a lot of, as I've mentioned before, it has led to a lot of people, especially young people, to end up committing suicide. Others, they will start isolating themselves, They will start to treat themselves differently. Others, they will go through depression, mental breakdowns. I went through that. It was so high. And that time I was still in college. I went through that. It was so painful, I didn't have any support. I didn't have any support in those weeks or year of me finding out about my status. It was so hard. The after effects of the treatment, God, it was so painful. I will have deja vus. I will hallucinate. I will sleep. Like, okay, wapupa ufila ngathi uyawa empedeni. That's what you will get. Imagine you not getting that full support. You are dealing with this alone personally in your personal space. Then mawuyanga ngaphandle, you want to get support. You are not getting that support. So it's just so sad how this whole thing is just, people are treating it, and building this wall because you are trying to protect yourself. I remember, I'm going to talk much about me because I'm going through that. I wouldn't say but I went through that. But even if when I went through that, I still go through it even today, I built this wall because I was trying to protect myself. I was trying to not allowing people to come into my space and start treating me. Already I was treating myself as if I failed myself. I failed my parents, I failed my family, and already it was just too much for me. I was getting annoyed. I was getting, hey guys, no thata. I nearly said a very sorry word, but no thata, and yeah, it was so difficult. It was so difficult. So when I was busy with my research and finding out about the statistics, interviewing people, wanting ukubona ukuthi ingqondo zabo zikuphi when it comes to this virus. Let's start about the statistics. The stats of South Africa shows that about 8.5 million people in the country are HIV positive. like 8.5 million people in the country, in South Africa, are HIV positive. How sad is that? And I believe that there is still more on that, there is still more on that. And SA has the most significant number of people enrolled on ARVs, which is a good thing, that it has most people, they are taking their treatment. Most people, they are trying to live a healthy and beautiful lifestyle, General Risinga Maluleke, the statistician, also mentioned that the number of those living with virus has increased from estimated 3.6 million in 2022, and we are already in 2023. Like, it has increased, estimated 3.6 million in 2022 to 8.45 million in 2022. Gauteng being the most, guys, come on. Gauteng being the most populated province, followed by KwaZulu-Natal. So in other words, in Gauteng, we still need more teachings when it comes to those things. And places such as KZN. I'm still asking myself, Uguti, our health department, when they see the stats, mabahlala phansi, what is it abayikhulumayo to make this whole thing to go higher and higher? Because the numbers, they continue to grow. The numbers, they continue to go crazily. From 3.6 million to 8.5 million people who are living with this virus. And what does our government say? What are we doing as a community to make, how can I put it? To bring a change to young people to know about this thing, Going through all these researches and findings, it shows that we still have a long way to go, when it comes to educating our communities. As I've mentioned before, Uguti, our communities, they still need to get teachings when it comes to those things, They still need to get teachings when it, especially youth, and teenagers, about HIV. What I find out also is the high rate of stigma discrimination to people who are living with HIV, especially in the rural areas. Remember that Gauteng is the most highest, and it followed by KwaZulu-Natal. Subtly discrimination such as gossip, 38.1%. Not treating them with respect, 20.7%, and keeping a distance. Angazi, why are you keeping distance umuntu ophila nge-HIV? Because it's not as if you're gonna get infected. 18.2% from people who are living with HIV and AIDS. That shows HIV-related stigma as the negative beliefs, feelings, and attitude towards people living with HIV. It causes discrimination and creates barriers that negatively impact HIV prevention. Impact HIV prevention. In other words, it makes a lot of people to be scared to go to the clinics. Also, in our clinics, we are getting a very horrible treatment when it comes to our status. We are being treated so badly in such a way that we are sabano we clinic because of how our nurses are just treating us. Imagine, let me say, a 19-year-old man or woman, we are at clinic, we are tester. Then, as soon as UNES, when I find out you are HIV positive. I won't not all the nurses, but some of the nurses userumini langapha and icolleague yakha ingale and uyashouta, Usibongiseni, he's HIV positive, please cancel him. You see how sad this thing is, of people being difficult, of them coming out and sharing their status, because already they've been mistreated in the healthcare services. And that's where you were supposed to find comfort and love. It's okay, I'm HIV positive, I'm going to the clinic, I'm going to get the help that I need emotionally, mentally, and physical. But no, you're not going to get that. Instead, you're going to be mistreated. Already your self-confidence, it's being destroyed because of that. Then it's going to be difficult for you to come out. That is why this discrimination and stigma has created a lot of barriers that negatively impact HIV prevention. It's just so sad that we are living in the world where we are just treated as if we are nothing. We are just treated as if we are deserving of that, you know. Even though HIV treatment centers are available in certain parts of South Africa, a lot of people, they are not taking advantage of the services because of the shame they feel and the fear of exposure, you know. So many clinics, but it's difficult for you to go there because of the shame and the stigma around it and the fear of exposure. Stigma has prevented them from receiving HIV prevention medications such as ARVs, which would otherwise help manage the disease and will also prevent you from transmission and improve upon their quality of life. It's just so sad. A lot of people have stopped taking their medication because of that. Especially women. They've stopped taking medication because of that. I remember once ex of mine, when I'm telling you that I'm HIV positive, I'm telling you because angifuna ungifilele sorry, but I want you to know, even though when my viral load is lower than detectable, ngifuna uwazi ukuthi usifaka kuphi, because after 3 months I go to clinic to review, I go to clicks to get my medication, and sometimes the medication they make you to feel moody. You eat, you don't eat, like you just feel like as if your world is collapsing. So me telling you, I just want you, when those moments come, you are able to handle me. But a lot of people, they have stopped taking those medication because of how they're getting the treatment, you know, and how they're just not getting the support that they're getting. Let's go to mental health institutions. HIV-related stigma negatively affects the mental health of people living with infection. In South Africa, women and adolescent girls living with HIV are at higher risk of low self-esteem. Remember what I said when we were busy discussing about that. In South Africa, women and adolescent girls living with HIV are at a high risk of low self-esteem, depression, and thoughts of self-harm, such as committing suicide, isolating yourself. So sad of how a lot of people who are in a mental health institutions are the ones who are living with HIV. Because ufila ngathi uyahlanya, you don't get enough support, your mental health just go in a way that you don't know how to even handle it. You don't know how to handle yourself. you just don't know. I remember I was asking a friend of mine, it's a guy, and I'm like, Guguye, would you date someone who's HIV positive? And he was like, yes, I would. But I would never sleep with that person without using a condom. And I was so glad that he mentioned that, because that it shows Uguti, he still wants to prevent himself. He still wants to keep himself clean. And others will say, no, I will never date someone who's HIV positive because I don't want to be infected. How are you going to get infected if that person takes their medication? How are you going to get infected if that person, they are trying by all means to keep themselves in a good way? We still need a lot of education when it comes to those things. We still need a lot of things. Education when it comes to, it's so sad that I'm a black community. Like, I'm getting emotional about this because my fellow sisters, the ones that I was attending clinic with, angisababoni clinic. When mangbuza ngabo, they're saying they've committed suicide because of the pressure that was getting to them. It's just so sad. Kubhlungu when, hey, kubhlungu guys, but we still need education when it comes to this. I was asking someone also who's a doctor, and I'm like, do our health providers have something to say when it comes to this HIV? And he sent me this healthcare provider HIV stigma awareness. Studies shows that HIV-related stigma and discrimination in healthcare settings contribute to keeping people away from accessing HIV prevention. And reading this part, I remember while I was in clinic, we were just talking about this. And someone mentioned, in some clinic, ama nurses, but saying is ama treatment. The ones that we are getting it for free, but now they are selling them. Especially abantu who don't want to come to clinic to test, or even if that person find out to test and is status like it comes positive, uyasaba uye clinic, then ucela unesi ukuthi ngicela ungizele ne medication, and people, they are making money out of that. So this thing, study shows that HIV-related stigma and discrimination in healthcare settings contribute to keeping people away from accessing HIV prevention, care, treatment services, and also prevents them from adopting key preventive behaviors. There are three main causes of HIV-related stigma in health facilities. Imagine where, I'll continue reading this, but imagine where you're supposed to get help. You are not getting any help because of stigma and discrimination. It's so sad. There are three main causes of related stigma in health facilities: the lack of awareness among healthcare providers of what stigma looks like and its negative effects on patients, healthcare provider fear of contracting the disease, angazi kanjani, and the association of HIV with immoral behavior. The lack of awareness among healthcare providers. So, me reading this, I reached the conclusion, Uyoguti, our healthcare workers, they still need training when it comes to treating patients who are living with HIV, because umsaba kanjani umuntu who's HIV positive ozolanda medication yakhe? How you getting scared of that person? And when you want to test that person, remember you took an uthatha inalite and uyamhlaba. You're supposed to wear your gloves, isn't it? I feel as if those nurses who are dealing with HIV, they also need to go through debriefing, because I believe that they are dealing with different people, especially when you find out about your status. Uyasaba, you feel somehow. So now, but then the healthcare workers, they need to go for debriefing and be trained, be counseled. Umuntu who's HIV positive, it doesn't mean that he's gonna infect you or somehow. Because it's saying the lack of awareness among healthcare providers of what stigma looks like. As I've mentioned before, someone goes to the clinic and they want to find out about their status. Unfortunately, they found out that they're HIV positive. Unes wangapha umemeza unes who's far away usibongiseni he's HIV positive. Instead of you calling that nurse private, imagine usibongiseni masekazi uphuma erumini and the shame on his face, that dark cloud is surrounding him, and unes njabulo makamemeza usibongiseni kunomakhelwane wakhe lana. Imagine how are they going to treat him in the community? Imagine that. To combat HIV-related stigma, it is important for health facilities in South Africa to create an environment where healthcare providers acknowledge that stigma exists in their facilities, especially in the Black communities. If only they can see what they are adding on to the stigma and discrimination of people who are living with HIV. And as a result, develop strategies and action plans to build staff and management support for stigma reduction and elimination. So our healthcare workers, they need to start treating patients, not only patients who are living with HIV, but every patient with love and care. Because some of the people, they end up not going to the clinic of the treatment that they're getting from the health facilities. Like, for example, you go to the clinic, they're saying your appointment is at 8 o'clock. Uzawuhlala clinic. Angisho uzaphatha isikhaftini. Let's say you are saying, okay, the appointment time is at 8 o'clock. Maybe you are just estimating, maybe I'm going to sit there for 2 hours. Uphatha isikhaftini for that 2 hours. What I've experienced in the public clinics is that you will sit more than 2 hours. Ufika ngo-8 clinic and uzowuphuma from 8 until 2 o'clock. And when you are trying to voice out your voices, they're giving you attitude. Some of the nurses, they will tell you, how did you? Hey guys, things that we are saying in our healthcare facilities when it comes to stigma and discrimination, it's just so sad. That's why this article, it's saying, to combat HIV-related stigma, it is important for health facilities in South Africa to create an environment where healthcare providers acknowledge that stigma exists in their facilities, and as a result, develop strategies and action plans to build a staff and management support for stigma reduction and elimination. They need to acknowledge their mistakes. They need to acknowledge that we are not doing right. They need to acknowledge that we are the one that are making people. We are contributing to the discrimination and stigma in our communities. We are contributing to people not wanting to come to the clinic and take medication or come and seek for help. They need to acknowledge their mistakes, They need to acknowledge ukuthi they are also in wrong. And this article also talk about educational anti-HIV stigma in interventions, humanizing HIV, involvement of people living with HIV in stigmatizing activities, utilization of social workers like us, It has a lot of things. But okay, we did talk about health and our healthcare facilities, they need to have like once in a week where they do workshops. While I was growing up in my primary life, I remember they used to have those workshops in the healthcare facilities or at school. Like you choose what kind of workshop that you want to attend. Funny enough, I was attending the one of HIV, not knowing that one day I will need this kind of workshops. But lately, there are no longer those kind of workshops, Educational anti-HIV stigma interventions. To facilitate HIV prevention in South Africa, educational anti-stigma interventions need to be implemented with a focus on providing information about the stigmatized condition of people living with HIV, correcting misinformation and negative cultural beliefs and attitudes about the disease, and rectifying inaccurate stereotypes or myths. So we still need those workshops where our healthcare facilities will teach people about this virus, will teach young women, young men, our families, our colleagues. We still need more education regarding this. These interventions may take several forms, including national television, radio, Finding Beauty in Your Scars podcast. Me doing this, I'm trying to send an awareness of what people who are living with HIV are going through. The stigma and all that, newspapers, they still need to talk about this. Every December we have World AIDS Day, but we are no longer celebrating that. I don't know, because it's a lack of knowledge or because there's people, they see there's no longer need for them to do that. I don't know, but I believe that we still need more education when it comes to that. As I've mentioned, televisions, radios, Facebook pages, live things that are happening. We still need those kind of things, campaigns, and how the stigma and discrimination is just the consequences of it, and how people, they start like treating themselves as if they are not good enough. We still need more education when it comes to those things. We still not need those things, or regular educational campaigns, as I've mentioned, that discuss and provide information about the actions and behaviors that are stigmatizing, the consequences of stigma experienced by people living with HIV, and the steps that can be taken into eliminate HIV-related stigma so as to promote prevention efforts. While educational anti-stigma interventions generally help to address public stigma of HIV, they have also been found to reduce self-stigma, improve stress management, and boost self-esteem. If you remember, I did talk about how the stigma and discrimination makes one to have low self-esteem. So this kind of awarenesses, this kind of education will also boost to people who are living with HIV. Others bazalwa nayo. I remember earlier this year, a friend of mine called me. He was crying. He was like, I need you to help this young lady, you know? I'm like, okay. He's like, okay. Abazali bakhe, they were HIV positive. Then in a nosiswa ke when bazala nayo this thing. Uma wakhe ushone phambi kwakhe and ushone besikazimoshela because I don't know if she wasn't getting enough medication or she stopped taking the medication. I never asked the full details. No baba ke same thing. No siswa ke same thing. So I think it was a family that was living with HIV. She will go to clinic, but she wouldn't take the medication or the treatment. And that it end up of her having a full-blown HIV and AIDS. And she was like, please talk to her and tell her that you are living with this virus. And you've been living with it and you've been taking your medication and you are also healthy. While in the process of me trying to have a meeting settle with that lady, I found out that she's dead. And what hurt me the most, it was that she died because her sister, she doesn't, I don't know, have enough knowledge regarding this virus. And the community also, they were also judging them. So you see how we still need the education and we still need to teach people about this virus, especially people like us who are living with it. It's doable. Living with this virus doesn't mean you're not going to get married. Living with this virus doesn't mean you're not going to have kids. Living with this virus doesn't mean that you are less important. Living with this virus doesn't mean that you're not going to have someone who will love you. Living with this virus doesn't mean you are not good enough. So I wish our Black communities can start teaching themselves, doing research about this virus, treating people in a way now when you're going to find out about it, you would want to be treated in a proper manner. So making this episode, I'm just highlighting the things that people who are living with HIV, what they are going through. I never had enough support system, but I told myself that I'm going to fight. I'm going to fight until the end. I told myself, I'm not going to allow the discrimination and the stigma in my community to make me feel less of a woman that I am. The rejection that I got from boys. The harsh words that I got from my own mother. I continue to take care of myself. I continue taking the treatment. And I remember when I told my boyfriend, I told him because I was trying to push him out, to push him away, because I was already used to getting rejected, or someone will say, no, it's fine, I don't care about your status. Then in the long run, in the long run, he doesn't pick up your calls or he will remind you of your status as if you are not being reminded every night when you are taking that treatment. So I'm trying to make an awareness that our communities, our schools, our churches, some of our churches, they will tell you to stop taking your treatment because God is going to heal you. Yes, we know that God is going to heal us, but they mustn't plant that mindset in zabantu. That's why I say, God helps the one who helps themselves. So you not taking a medication and not praying, not taking good care of yourself, you think God will just heal you like that. It's not working like that. Take your medication. Be teachable about those things, especially if you just find out about your status now. I would say associate yourself with people they are going to help you in this journey. I was helped by my late mentor. She was also living with HIV, and she was the one who was teaching me about this whole thing. Then in the long run, I met people such as Kimu, who are living with HIV. I was listening to Nozibele's podcast. If you know Nozibele's podcast, you can follow her on Instagram, and she's living boldly about her life. And I remember in the podcast that she was being interviewed by Mpumile Dwaba, she mentioned that when she found out, she never told her mother about her status until, I think it was last year or last of last year, when she told her about her status. I don't remember. And she even mentioned that her husband, the one that she's married with right now, they got busy, Sheila, and she was like to him, I'm HIV positive, I'm living with this, I'm not a good woman. And the husband was like, I don't care about that. I'm here to love you. I'm here to treat you as a queen that you are. So it shows that there are still people out there who love you with your status, who take care of you, who'll appreciate you, who'll never treat you. And our communities, they need to, I believe that if we don't continue with awareness, the rate of people living with HIV will continue to grow. And it will grow even further to the poor communities, because there is a line between poverty and HIV. I think I did mention that before. Mostly that link affects women because of them low educational levels. We did mention that before. Low marketable skills, lack of knowledge or information regarding the risk of infection, and the lack of resources to act on this knowledge. Lack of resources such as campaigns, education in our radios, TVs, and all that. So I'm pleading with our communities that they must teach themselves when it comes to this virus. People who are living with HIV are not as bad as it is. As I've mentioned, it's not the virus or the disease that kill people, but it's the stigma and discrimination around it. It's how our families are treating us because of this virus. It's how our colleagues are bullying us because of that. It's how we have neglected this whole thing. It's how our health facilities, they just stopped doing the workshops regarding that. We need to be teachable when it comes to this virus. In closing, may we not treat each other in such a way that you wouldn't want to be treated. May we respect each other's flaws. May we be a community that it's united and that it's teachable when it comes to this virus. May we love one another. May we not make each other to feel small or to feel as if we are deserving of this. May we stay united. Our health facilities start putting plan of action on how you're going to start treating every patient with love and respect. our health government, can we go back to that thing of teaching about this virus? I hope this topic will bring a change in my community, and I hope it will bring a lot of teachings in young people and my fellow brothers and sisters that it's not the end of the world if you are living with this virus. You're still gonna get love. You're still gonna get your forever yena. You're still going to be happy. So in closing, may we love one another. May we treat each other with love and respect. Remember, we are all equal and same in the eyes of the Lord. With that being said, may God of love and God of peace give you joy. May you get all the healing that you need. May the positive energies locate you. Wishing you peace, joy, love, and happiness. This is your beautiful host, HelenZanele Chico. And this is a safe place where we are sharing our pain, our sorrows, our frustrations, our scars, without judging each other. Thank you so much for your support. Thank you for clicking on those links and making sure that we are getting the full support that we are getting. We don't take your support for granted. We don't take your love for granted. I wish you joy, peace, love, and happiness.
The Unspoken Truth is the catalyst for important and thought-provoking conversations that need to be had. The network tackles social ills, spiritual healing, soul-searching, and mental health awareness. To subscribe, click on the show link to follow our podcast and be part of the Unspoken Truth family. Find us on all social media platforms.